According to the National Breast Cancer Foundation, 1 in 8 women will develop breast cancer in their lifetime. In fact, they estimate that this year alone, 287,000 new cases of invasive breast cancer will be diagnosed, along with 51,000 cases of non-invasive breast cancer. And just this morning, we learned that journalist Katie Couric has breast cancer. She wrote on her website she was diagnosed a few months ago after her gynecologist reminded her that she was due to come in for an appointment. Now, Saturday kicks off Breast Cancer Awareness Month, and joining me now, Dr. Kayla Griffith. She is a breast surgeon over at Rose Medical Center. We're going to talk about an event that you are part of tomorrow, but I want to start with the importance of breast health this month, really every month, not a topic that any woman can ignore.
Right, just because it's October, that's not the only time we do breast cancer screening here in the United States, and it's not the only time it's important. You know, breast cancer happens on holidays and birthdays and vacations and sick days. It happens during pandemics. You know, cancer doesn't sleep, it doesn't take a break. So it's really important to make sure you're doing your annual screening so that you catch things early. Catching things early means that maybe, you know, your cure rate is in the high 90s approaching 100, and that, you know, maybe you can avoid chemotherapy or radiation therapy and things that are much more difficult with breast cancer treatment.
And that's why you obviously want to schedule those appointments. So you're speaking at an event. It's part of a series. Tell me a little bit about this.
Yeah, it's basically with a group called the Lotus Network, and this is at Rose Medical Center tomorrow, 12 o'clock to 1:30. You can actually find it on our Instagram under Colorado Breast Health if you want more information. But it's basically a group of women that's out there in an event that's meant to help, you know, encourage purposeful living with women. And so it's about education, empowerment, and encouragement for women to really kind of take their own kind of hand at breast health and really do what they need to do to live happy, healthy lives.
So during this Breast Cancer Awareness Month in October, what is the one thing that you want our viewers to remember or to take away?
Again, it's not just about October, but you know what? It's a great excuse to get out there. Every screening center is open, and I think Katie Couric is a prime example, right? She's 65 years old at her diagnosis. That's the average age of a breast cancer diagnosis in the U.S. She is a healthy woman. She did nothing wrong, living her everyday life. She still got breast cancer, even after her unfortunate situation with her husband. And you know, we in Colorado, we have the highest population, I think, in the United States of young women with breast cancer. We have a lot of women under the age of 50, which is just absolutely unheard of. And so it doesn't matter if you're young, you're healthy, you're busy, on vacation, or whatever it is that's going on with life, you know, cancer doesn't wait.
All right, Dr. Kayla Griffith, thanks so much for stopping by and for
Absolutely.
all that important
Thank you.
information for our viewers. The health series Dr. Griffith is speaking at tomorrow, we want to make sure we get that info for you one more time. Tomorrow, it's part of a partnership between the Women's Hospital at Health One's Rose Medical Center and the Lotus Network, as she mentioned. Now, there is limited seating. You can register and learn more about it at lotusnetwork.org.